Hey, buddy. Happy New Year. How are you?
I'm doing great. How about you, Dr. Brandt?
I am doing well. It's good to see you. You look comfortable and pain-free.
Oh, yeah, I am. And matter of fact, doing very well. Thank you.
Oh, that's great. Over the past 3 years, we've treated you for a couple of body parts. We've treated you for your cervical facets, for your lumbar discs, and for your shoulder. And kind of in pairings that I won't get into the details of, but kind of tell me a little bit about what you were experiencing pain-wise and discomfort prior to coming to me and what's transpired since.
For a number of years, I was having just terrible low back pain and in the joints there, and I tried about everything that you could think of as far as chiropractors and that kind of thing, and numerous exercises, and nothing seemed to work. And I had epidural injections, and all that stuff was just a very temporary fix, and really wasn't even much of a fix. But that's the reason I came out to see you, and you started on the back there, and it worked out very well. And then you did the facet joints, and in the meantime, the shoulder started giving me trouble, and we got an MRI on that and found that there was a tear in it. And you treated that, and very successful. The doctors here in North Carolina were wanting to operate on it, and I had some friends that had that. In fact, one of my neighbors told me that he had slept in a lounge chair for a couple of months, and he had it done at Duke, and he went back, and they told him he needed to redo it, and he said, nope, I've slept in the lounge chair all I'm going to, and that was sort of enough for me to decide I was not going through what I saw him go through. So you were able to treat that, and done very well, and I'm back playing golf, and it worked out very well.
It had been quite a while since you were able to play golf prior to starting treatment with me, correct?
I had not played in 2 years.
Wow. Well, that's great. That's fantastic.
When I finally got back on the golf course after 2 years, it was quite amazing. The foursome I was playing with, they all knew I hadn't played, and everybody was, thinking, well, old buddy's gonna step up here and hit it right in the woods, and I nailed it right down the middle of the fairway.
Good for you. That's great.
They said, well, we don't think you're having shoulder trouble anymore.
And buddy, as far as working with the office at Thrive MD and making arrangements to come in and all of the details, was that pretty easy for you?
Absolutely. Your staff there is just great. They were very accommodating. I assume you're very accommodating even with the people that are close by, but since I'm so far away, they just, several times I had to make some changes, and they were very, very accommodating, and just a pleasure to work with them.
That's great. And as far as the procedure itself, the procedures you've had, you were comfortable doing them, and the post-op, wasn't too terrible?
I didn't have any problems whatsoever. It was quite amazing how well I did, because I had procedures, and then as quick as I could get back, I was right back at work, just like nothing happened. And they never felt really any discomfort, not even as much as you told me I might feel. So it worked out very, very well. I was extremely pleased with it, and would certainly recommend anybody to come see you, just based on the experience I had.
Well, that's great. We really appreciate you taking the time to share your experience and tell people a little bit about your whole sort of walkthrough of being here. Anything else you'd want to share with them? Cut you off?
Well, if any of your folks, future patients, would like to give me a call, I would be glad to share with them the experience I had. And look forward to, if anybody had any concerns and wanted to talk with me, I'd be glad to talk with them.
Awesome. Well, thank you very much once again. It's great seeing you. You look terrific. And
well, thank you.
we will hopefully get out and play golf together soon.
Oh, great. Look forward to it.